I think it's really important to challenge myths about psoriasis because I think there's a lot of them. And so one of the classic myths is that psoriasis is contagious, and it's absolutely not contagious. One of the experiences I had with patients is that they'll come in and ask for a letter to go swimming in the pool, which is really sad because psoriasis is not contagious, and that our patients with psoriasis should feel comfortable to do all the activities that they love to do. So typically we think about psoriasis as only affecting the skin, but that's not true. It causes inflammation in the skin, but it also causes inflammation elsewhere. And so the rest of the body, including the heart, there's low level of chronic inflammation. And that can lead to coronary artery disease, which can then lead to heart attacks. And sometimes people will say that psoriasis can cause fertility issues, which is not true. Psoriasis in no way affects the ability to conceive. One thing that we also don't talk about enough with psoriasis is that can also involve all areas of the body, including the genitalia. So with men and women, they may not feel comfortable being intimate with their partner. And that's really unfortunate. I think it's important that patients feel comfortable talking to us about it because we have a lot of great treatments for psoriasis and to make sure that you do feel comfortable. So it's a myth that all types of psoriasis are the same, or that psoriasis is just one type. So there's actually several different types of psoriasis. And so plaque psoriasis is the most common type of psoriasis that we see in our office, but there's several different types of psoriasis. So people will commonly think about psoriasis and eczema as if they're the same thing or even on a spectrum, when in fact they're really different. So psoriasis, we typically think about these thick psoriasiform plaques on your elbows and knees, and we can contrast that with eczema, which generally is associated with allergic rhinitis, or basically hay fever, environmental allergies. And also it can be associated with asthma as well. And that's typically what we think of as the atopic triad, which is basically these three things in combination for eczema. A common myth is that your diet doesn't matter with psoriasis. So with psoriasis, we know that you'll be at increased risk for an elevated BMI, for insulin resistance. So that's really what I talk to my patients about, is having that healthy, well-balanced diet, because that can decrease the manifestations of both the skin psoriasis and also that chronic low level of inflammation that's going on in the skin. So often people think about a cure for psoriasis. And while we're getting closer and closer to that goal, psoriasis is not curable, at least at this time. The great thing is that we have a lot of great treatments for psoriasis, because for the longest time we didn't really have those treatments available. And it was frustrating for us as dermatologists because we want to help people get clearer skin. And so now we have the tools really to accomplish that. And so that's really exciting.